Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society. And this is a more moderate deep bite case. And this can be done good too. And we'll do these type cases. There's a world of them out there that people can do, and that people can chew better, last better, looks better, and everything about it, and can be done orthodontically, and you could help it surgically, but it's not something that is normally done. Now when you look at this, his models here, you don't see his lower teeth. You look right across here, and his bottom teeth are way up in the roof of his mouth here. This is common. I mean, and you can deal with it, and you need to widen this bottom teeth out to have them fit better down here. I don't just very rarely see this like that. So let's get started. There's no big deal to this type of case. You take an intruding arch, put it up here like that, and pick these teeth up, and it pushes down on this. It opens about a little, moves these teeth down, and they come down with that, and then you can come in and correct the relationship between the teeth and have it fit better too. See, we've used elastic across here, it looks like, and we've got maybe class 2 elastics. It's just a dozen ways of doing something like this. Now that needs to be opened a little bit more and change the angle of these teeth. You can put a little more torque in them, bring them out, let this come in together better. All right, I'm going to go through this pretty quick and show you that there's just a lot of this type of orthodontics out there. And if the orthodontic schools had it years ago, I tried to get them to teach orthodontics to general dentists and everything. They said, no, we're not going to teach it. People just don't know what to do. If you show them what to do, there'll be more of them than people can come in and do. And that is a fact. And so by cutting down on what I think it was the regular orthodontics, I have many friends who are good orthodontists, and they do adult orthodontics to some extent. But some of them say, well, they'd rather do children where they can line them up and to go through it. They're almost, a lot of them the same. Here, this you got to think about each case as you do. But this is a nice fella right here. There's nothing reason we couldn't come in there and help him out. Now this is 03, when I got the model 03. Now he's worn his front teeth down. You see that enamel, and it didn't raise out down inside the enamel. He's got a little bitty tiny wisdom tooth back here at the back of the mouth. And all kinds of things, having them fit together good. Now this is a class 2. See, this tooth right here ought to be fitted in like that. This ought to be back. Well, the deep bite keeps you from moving your jaw to the front. So you just got to learn how to open the bites. So we're going to push these teeth up, and you work off of this tooth here. It'll push down, but these teeth are hard to move. And so it'll raise this up, and you open that up, you bring this down, and this tooth right here will pay for the price of bringing that down. I don't see any wisdom teeth back here, and I'll guarantee you when you open this up, that this jaw will want to come forward. Now a lot of people have TMJ problems up here. They can't get their jaw out far enough there. All right, it's closed, you can see it there. Now watch. Now this They took the models and looked at the camera from this side, and you see where the lower teeth are fitting here against the gum line on this guy. So he's been chewing his gum and irritating it in here for years, and you'll come in, take those down, and pick the upper ones up, and fix it where that fits better in there. That's commonly very, very many people are like that. And why the orthodontics, and I'm not fussing with those, I've got a lot of good friends that are orthodontists, why they don't teach this more in the schools. That's what the educated people ought to be learning instead of some of these ridiculous things they're trying to teach them. Now we'll open that up. Now see where the lower teeth were hitting here, wearing that down, hitting right in this area, and these teeth are closed. We'll open that. And now as that comes down and this goes up, the lower jaw moves forward, but we've got some elastics to help it if it doesn't come out where we want it. And the midline's coming in there pretty good. Now, can you see this rule, this wire right here went up this way? We pulled it down. It'll pick anything up. You can open anybody's bite as long as they're living. It doesn't matter how old they are, what nationality, anything else. Now on the bottom, if it was straight, we didn't need it. We did most of the elevation, pushing these up and these go down to open the bite. And this wire right here, I don't tell you, I have never seen a case that you couldn't open with something like that. Just put it on and gently the force moves it up and the bone and the teeth move together all in a group. You don't pick one up and leave it. You do the whole thing, and over a period of not too long you can open the bite on this guy, and his lower jaw then can move forward. In other words, when it's like that, it can't come forward. You open it up and it will. You move these out of the way, this will move up over that way. To get across to everybody that this is not some impossible to do. I've shown you those really tough cases. They're possible to do if you just do one portion. You could do it. Any breakdown into any of the different things that you can do. You can rotate any tooth in the mouth. You can raise them up. You can bring them down. Now these we raise it. These will come down and they'll level that thing out. And it can be done, and you don't have to be some special somebody. I never went to orthodontic school, thank God. And so I didn't know what wouldn't work and what would work. And whenever I got something that an orthodontic school said couldn't do, I just, for regular spite, I guess, I would, if I got a hold of the case, I would do it so help me God. I mean, we'd get it done and show them that it could be done. And I know in some areas they just dislike me very much because I kind of did things that they didn't do. And so I was trying to force that on them. And really, that's what I'm trying to do right now, is to let people do the simple, easy stuff, and the people that go to the universities do the tough stuff. Charge them more if you want to, whatever, just, but you don't have to spend a lot more time. You do a few of these, and you will learn how to do them just about as quick as you could a simple case. Now that wire right there would be up here. You bring it down, picks those teeth up like that. And if you need to, if you come up with you want to change the torque, you can go through and put a rectangular wire in here and have the roots go however you want the roots to go in a case. So this is 03. There's 04. Now we use the class 2 elastic. We pick these up, raise these out of the way. This is coming forward, and we use this rubber band on this left side to come that way. Got the intruding wire there. There we go. This is something you ought to have triple tubes up here and double tubes down on the bottom to set up to do this. And we ought to have somebody try to get a man in California, there's somebody to make a kit with the stuff that we use to do this. And I'm still going to try to do that. So now you've leveled this all out, you line that up, and that finishes this guy up, and he's in good shape. And if you level it out and put the retention in there like it should be, I don't have the retainers to show you right now, but if he'll wear those for a while until everything, the pressure going in and out this way is about the same. That's where the teeth will eventually go to, so you have to keep them in order while it gets to a normal position of pressure on the outside and pressure on the inside. Thank you for watching, and I hope that people anywhere in the world will learn how to do these things. Thank you again, and keep watching our videos. I'm going to try to get 1,000 of them. We've got 900 and I think about 34 or 5 now. So I'm going to say goodbye.